child is presented to emergency with the history of ingestion of certain unknown fruit. Patient ने क्या खा लिया, एक बच्चे ने unknown fruit खा लिया. Now he is having issues. What are the issues? Like patient is having blurring of vision, midriasis is there, blurring of vision. मतलब blurring of vision, midriasis मतलब the pupils are dilated. If the pupils are dilated, patient is not able to see, right? Patient is having dry mouth. Patient is having dry mouth. Why this dry mouth is happening? Because this is some kind of a anticholinergic poisoning, right? Inability to pass the urine. I've told you cholinergic, anticholinergic पढ़ाया है, फिजियो में भी पढ़ाया है, फार्मा में भी पढ़ाया है, right? So he will be having problem with the passage of urine because bladder is not contracting, right? He will be having restlessness. What is the antidote? First of all, you need to identify the poisoning. What is the poisoning we are having over here? In this particular case, what is the poisoning they are talking about? So what is going to be your diagnosis in this particular case? Remember, your diagnosis here is going to be some anticholinergic poisoning. Anticholinergic poisoning. कैसे पता चला anticholinergic poisoning है? Sir, cholinergic nervous system is going to contract everything, right? It is going to contract M1, M3, M5, right? I've told you. So M1 contract होगा, M3 contract होगा. What is going to happen? You will be having contraction of pupil. Sir, meiosis is the feature of cholinergic system and midriasis is the feature of anticholinergic system. So this particular patient is having what? Midriasis. Okay, urine increased passage of urine is a feature of cholinergic system. That is what we have seen in the cases of organophosphate poisoning. OPC में क्या होता है? कपड़े गंदे हो जाते हैं, right? I've taught you M1, M3, M5. Last time we can revise M1, M3, M5. So what is going to happen? They are all going to do what? They are GQ subunit. They are going to do what? Contraction. So you will be having contraction of salivary gland. That means more saliva will be coming out. You will be having contraction of urinary bladder. That means urine will be going out, right? So what is going to happen? So this is some kind of anticholinergic poisoning. What others anticholinergic poisoning do you know? So it can be either it can be dhatura poisoning, dhatura, it can be belladonna poisoning, it can be atropine poisoning. Remember, all these three things are going to be working on the same principle. All of them are what? Anticholinergic things, right? And what is the drug of choice for all these things? Drug of choice for anticholinergic poisoning or drug of choice for dhatura, belladonna or atropine poisoning? Yes, waiting for your response. What is the drug of choice for dhatura, belladonna or atropine poisoning? All are not exactly same, but they are having the same principle. They are having the same principle. That means their symptoms will be same. Like whenever we are having any cholinergic poisoning, what is going to happen? The symptom remains same. Okay, symptom remains same. Very good, Rituraj. That is going to be your physostigmine. Drug of choice is going to be physostigmine. It is going to do what? It is going to increase your acetylcholine, right? इसमें क्या और एंटीकोलिनर्जिक में acetylcholine कम हो गया. Now what we want to do? We want to increase our acetylcholine and the drug of choice will be physostigmine, right? So this is the drug of choice in this particular case. That is going to be your physostigmine. When we are going to use atropine plus pralidoxim, atropine plus pralidoxim is the drug of choice for organophosphate poisoning. OPC poisoning में use में लेंगे, right? OPC में क्या हो रहा है? We will be having opposite symptoms. OPC में opposite symptoms I have taught you in detail, right? वहाँ से देख लेना अगर कोई भी issue है तो, right? So OPC poisoning we are going to have certain problems, right? And to treat them we need to give what? Anticholinergic drug. That is going to be atropine. In fact, this atropine I have taught you in medicine as well. It is going to be drug of choice for bradycardia with AV block. It is going to be drug of choice for bradycardia with AV block. AV block, right? It is going to do what? Atropine is going to do what? Atropine का function क्या होता है? Atropine is going to increase your SA node. That is going to be increasing your heart rate. It will be increasing conduction, and that is what is happening here, right? Next thing, what is about this digibind? Digibind is going to be what? It is going to be antidote for digoxin. It is going to be antidote for digoxin. And where do we use digoxin? Can anyone tell me what is the most common type of arrhythmia you will be having because of digoxin? Most common type of arrhythmia you are having because of digoxin is going to be your, yes beta, that is going to be your ventricular bigeminy. Ventricular bigeminy. Whereas the most specific type of arrhythmia, if they ask you most specific type of arrhythmia because of this, that is going to be NP80 with AV block, that is going to be non-paroxysmal atrial tachycardia with AV block. And this digoxin we are going to use in the cases of heart failure. Okay,